Hey guys, I'm Julie Keene. I am a clinical nutritionist. I have been doing this since 1996. I started my practice. I started my career in psychology. I wanted to be a child psychologist. I was working with kids in a locked psych unit and became interested in using nutrition instead of medication and psychotherapy. All of this is on my website. I just wanted to give you a little background. I've been a clinical nutritionist a long time, very highly trained in functional medicine, and as much as I could learn on how food affects the mind and the brain and overall the body. And I've done clinical mentorships and worked with some of the best people in the world. And I want to talk about some chronic health issues, mold, Lyme, interstitial cystitis, because I would say about 2010, I found myself, maybe 2012, I found myself super sick, and I guess it was in 2010, and it got considerably worse over time. Really sick. Some of the main issues I had were fatigue, insomnia. I would try to go to sleep at night and I would feel very like wired and tired. I called it because I was like exhausted, but felt so anxious and like bzz, kind of buzzing, and I couldn't sleep. And no, I don't have a history of mental illness, so there was no reason. But although I was looking into those things, I had joint pain as time went on. My hands got so bad I couldn't drive. I had a lot of problems with my bladder. I was having urinary frequency. I felt like I had to pee constantly. I had urgency, like when I had to pee, I felt like I had to pee right then. And then what happened, one day I was teaching classes for Nissan, a big corporation, and I taught kind of class after class all day long, and I hadn't had much to eat. I had, I think, some barbecue chicken and maybe a Diet Coke, which I don't eat anymore. But I had a new baby. My daughter was a couple, not old. She was a little kid, a toddler, and my stomach like bloated out of here, and I could not urinate. Long story short, I wound up in the hospital, the emergency room that night after teaching all these classes all day, just terrified because I was in so much pain and had these bladder issues going on. And what they actually, I had to use a catheter, and they said that it was some kind of a bladder spasm, and they didn't know what else to tell me and gave me some muscle relaxants and painkillers and catheterized me and sent me home. And I was really terrified because I didn't get any answers. I know that I was eating healthy at the time. I know that there wasn't really an answer I could see. I had one doctor, luckily, my general doctor at the time, did very in-depth labs for me, the best that he could do, being just a conventional doctor with an open mind. And he knew me too. He knew that it wasn't normal for me to be having all those symptoms, mood issues, anxiety, depression. I couldn't drive well. I had depth perception issues. I was hitting my car into things like posts and things. And I've been driving a lot of years, so that was weird. He tested me for viruses, and Epstein-Barr virus came back, and I believe cytomegalovirus at that time. And he very much believed that chronic fatigue was a thing because his daughter had suffered from it. And I went about trying to fix that. I did everything I could find to fix chronic fatigue, and I would, and my hormones were out of balance. I did everything I could to fix that. My thyroid went out of balance. I wound up with the Hashimoto's, which is an autoimmune thyroid. I kept like plugging these holes everywhere. The bladder got worse and worse, and I don't know how many of you have interstitial cystitis, but it's really painful, really hard to deal with, really makes your life unbearable, kind of like they call it IBS of the bladder. I wasn't really having IBS or gastrointestinal symptoms at the time, luckily, I think because I took good care of my nutrition and my microbiome and took probiotics and ate a pretty healthy diet. But maybe I just couldn't have handled all that either. So I was really debilitated by the interstitial cystitis. And at the time with interstitial cystitis, I went to the only urogynecologist I could find who had experience with it. She was at Cedars-Sinai in West LA, and they literally had a little booklet they hand out that said, if you have IC, you can live a normal life. We know it sucks, it's hard to live with, but if you can use narcotics and stay away from all foods that set it off. Trigger foods, which basically was everything, like tomatoes, lemons, anything spicy, any kind of spices or condiments. Like, it was a lot of things that I could not eat, but I tried the diet diligently, and it's a low fruit and vegetable diet as well, some vegetables, because that stuff can be acidic and irritating, so it definitely is not a healthy diet to be on. It gave me a little bit of relief, but nothing that I was hoping for, nothing life-changing. So basically all these issues got worse year after year. They got worse, and what it turned out to be, I know now, and it was a long series of me uncovering things and getting to the next level of knowledge and just not giving up. And I really did want to give up because I was so sick that I could not get out of bed for a couple years there, and this whole thing was going on until 2013. The end of 2013, I was just ready to give up. Like, it was just too much suffering, especially for me, somebody who had taken care of her body so, like, with a vengeance for so long. I just didn't understand. I was too wiped out to exercise anymore, and exercise and was how I got my fun. I loved dancing and horseback riding and all skating, like all the stuff I did, I couldn't do anymore. I couldn't participate in my daughter's life because I was sick all the time. I couldn't even like work with my patients anymore. I was starting to get brain fog and forget things. For me, it turned out to be extreme mold exposure in the townhouse we were renting. It was behind the walls, like kind of like these walls, but this is a brand new place, so I know that's not a problem here yet. The landlady was very negligent and didn't ever want to fix anything correctly, and we did not know because she would just, if something broke, she would get a unlicensed contractor in there and just paint over everything and kind of put a band-aid on it to make it look good. And what happened is I got sicker and sicker, and she watched me look for answers. She watched me kind of fade away and get sicker and sicker. I had a weight problem. I blew up even though I was barely eating and eating mostly the same stuff. Like, I put on, I would say, 30 pounds, which is nothing that had ever happened to me. Even when I got pregnant, I put on less than 30 pounds, and it came right off after because I'm active and I eat healthy. So I'm putting this out here because I want you guys to know that mold is serious. Mold exposure is serious. Dave Asprey did a great documentary called Moldy that you could probably find online if this is the first you're hearing about it. I just want you to know that mold is very much connected to interstitial cystitis. I used to be able to talk to people on the phone about this and try to help them as best I can, but I'm working a lot now, and I have a couple projects that I'm working on trying to get some books out, so I don't really have time to do that. So I wanted to start to make videos so that I can send people to those and they can get some help. So I want you to know that mold and also viruses, the Epstein-Barr, the cytomegalovirus, the herpes viruses 1, 2, and I think I always get these mixed up, but I think it's like 5 and 6 maybe, those other herpes viruses. These are stealth viruses that I think cause us a lot of problems. And I think viruses, mold, gut pathogens like yeast and candida, Klebsiella, citrobacter, sometimes C. diff is involved. I had C. diff that happened after a dental surgery. So I think that this is kind of a perfect storm. But if you're living in mold and you're one of us lucky people who are genetically susceptible to getting mold sick, and mainly because I think we cannot detox the toxins out of our body quick enough. I don't make a lot of glutathione on my own either. If you're one of these people, which my daughter turned out to be as well, she got sick after I already got well or started to get well, then there's a good chance that you need to check if you're living in mold. And if you know you're living in mold and you have chronic illness issues, you need to start to wrap your head around that, get your body tested or get your home tested by a reputable person. I hired some slimy people who were dishonest the first few times, and it made me live in the mold an extra almost a year, which who knows what that did to inevitably to my longevity and my health. But I'm healthy today. I just got off a 9-hour day of seeing patients, and now I'm making videos. It's like 9:30 at night, so I'm healthy. I'm super grateful for that. There is a way out of it. I'm going to start making these videos and try to get some articles up and things like that. But the first thing is get your head wrapped around the fact that there might be mold and get some testing done for you. And I guess stay tuned. Let me know by email or comments if you would like more information specifically on this. Also, my daughter got mold sick after I did. We actually wound up moving out of that place. It was ridiculous. We were homeless for a while. We were going from hotel to hotel. A lot of time hotels are moldy. We wound up with relatives for a little while and couch surfing, and then we actually went and rented another place where they swore to us that it was clean. It looked like a complete remodel. They told me it was completely renovated down to the studs, and we were there 4 or 5 months, and my daughter just got so sick. She hadn't really been sick before. She got something called POTS, which is postural orthostatic tachycardia syndrome, and she was debilitated. She was bedridden for most of the rest of that year. That was 2016. And literally, I stopped my practice again after only being back for less than a year after my sickness, and just nursed her back to health. And we had to leave that place, so we went to stay with relatives again, and from hotel to hotel, home to home, doctor to doctor. I found her a great POTS doctor down in the San Diego area, and several other doctors, and worked on everything we could for her. And she is healthy again today as well. She's pursuing her life's dreams and not wasting a lot of time being sick. She's not 100% yet. I would say I'm usually at 90%, 85, 90. She's probably at 60 to 70 most of the time, but we're working on getting her higher because she was down to like 15%. She could not get out of bed. So there are slimy people out there that will tell you their house is mold free, even when you look them dead in the eye as a mother and say, we can't afford to move back into mold. Can you please tell me that this renovation was done correctly and that there's no mold? He looked me right in the eye and said, I promise you it's clean down to the studs, right in front of my daughter. So test before you move in somewhere. If you're renting or you're not sure, get it tested just to make sure, and spend as much time in there as you can to make sure you don't react. We spent some time in there, but it obviously wasn't enough because it took almost 4 months before we knew what was going on. And then when she fell, she crashed hard. So hope that helps somebody. Leave me some comments if you want more specific info or whatever. Thanks.